The broadcast is now starting. All attendees are in listen-only mode.
Hi there, everyone. Welcome to today's BGA webinar on supply management. We have today Professor Kovacs, who is the ERCA professor in humanitarian logistics and is the subject head of supply chain management and social responsibility at the Hanken School of Economics in Helsinki, Finland. She's the founding editor-in-chief of the Journal of Humanitarian Logistics and Supply Chain Management and is on the editorial board of several other journals, including Production and Operations Management and the Journal of Operations Management. She led the Humanitarian Logistics and Supply Chain Research Institute, Hanken School of Economics, since its establishment back in 2008 until 2014. And she has published extensively in the areas of humanitarian logistics and sustainable supply chain management, and is currently leading the EU project Heroes of the COVID-19 response. So without further ado, Professor Kovacs, welcome on board. Thank you so much for making it. And we're very much looking forward on this topic of humanitarian logistics and sustainable supply chain management.
Thank you so much. Just a bit of upfront, I have no idea who you are in the audience, so maybe every now and then it would be really, really nice if you dropped a line in the chat so that we know what you think and also what you want to hear more about, because there are a couple of things that I intended to talk about, but then we can a bit tune it depending on what you are interested in. The topic I was given was humanitarian logistics and sustainable supply chain management. I do a lot of research in these areas. We also teach a lot in these areas, but there are certain specific issues I would want to revisit today. I know I sometimes speak too fast, so you also have to stop me if I do so. So those are kind of just the things up front. My name is Gyöngyi Kovacs. Nobody can pronounce it, nobody can write it. I can live with that, and don't worry about it if you're mispronouncing it, if you happen to speak back here. As Victor said, I'm the ERCA professor in humanitarian logistics, which is kind of a nice place to be because it's the first professorship in humanitarian logistics worldwide. It also comes with the fact that we do a lot of research in this area, and we have a research institute which is called the Humanitarian Logistics and Supply Chain Research Institute, or HUMLOG Institute for short, that we are working with. That's a joint institute between the Hanken School of Economics, where I am, and the National Defense University in Finland. But let me just show you what I thought about talking about today. I understood that some of you are probably very well reversed in these research areas already, others maybe less so. So those of you who are very well reversed, please bear with me when I'm going through a bit of concepts and the context of the area I'm talking about. And then after that, I want to go to two main topics. One is, because it is very much in everybody's minds what to do in a pandemic, and especially with COVID-19. So I'll revisit that a bit more in specific. And then I'll widen the perspective on what it means to talk about sustainable humanitarian supply chains. I won't talk too much about our HUMLOG Institute, but do feel free to ask any questions about that. Yeah, welcome. Let me start with the basics and give you a bit of the context. And I wanted to just highlight a number of different operations and types of disasters and types of kind of environments that humanitarian logisticians work in. Maybe just up front, the reason I have the Syria operation overview here is the following. Apart from the Syria operation really being one of the largest operations currently, it's also been around for a long time. And to be fair, when we talk about humanitarian logistics, it's very sexy to talk about the natural disasters in the world. But to be honest, most activity is in conflict zones. So whether we talk of Syria or Yemen or of South Sudan, you name it, conflict zones is where a lot of humanitarian activity is ongoing, and especially also logistical activity. And delivering aid in conflict zones is a specific area in itself, which with its own challenges, of course. Another thing I wanted to show you here is what is ongoing in Zimbabwe right now. Both because this is an operation, for example, this is also from the Log Clusters website that looks at preparedness and looking forward to the next crisis. Also because there is a lot ongoing in Zimbabwe. There have been several consecutive droughts by now. The food security situation has been bad already previously and is just deteriorating. There are huge cash-based programs ongoing at the same time as there is hyperinflation. There are issues with the currency, and then I don't even want to talk about the political issues and the healthcare-related issues that are ongoing there. Now, one of the reasons that Zimbabwe is close to my heart is that I've spent my last fall in Zimbabwe as a humanitarian logistician myself. This is maybe also something that you might see with many of us at the Humlog Institute, that not only do we do research in this area, but many of us are also on rosters of humanitarian organizations. So I was in Zimbabwe last now as a procurement delegate of the Finnish Red Cross. But that happens to be that particular organization. Others of our team are with other organizations sometimes. So we actually have now some people deployed for COVID-19 response as well. Then on the lower part of this slide, you'll see more healthcare related aspects. This is from Ebola, but that is also just to give you a flavor that not only do we deal with natural disasters and conflicts, but yes, humanitarian logistics is very active also in pandemics. But to start with the conceptual matters, there are two definitions I put up here. One of them is not of logistics. The first one is of disaster relief. And the second one is the probably most commonly used definition of humanitarian logistics. You might just note one thing about the first one. Even though it's not a logistics definition, it actually talks about a lot of logistical concepts. It talks about material flows. It talks about transportation. It talks about supply points, destination nodes, transfers of people, and so forth. So not to be surprising, humanitarian logistics then plays quite an important role in these kinds of environments. And that goes for any kind of disaster. The definition that we use in humanitarian logistics typically is this one that is given here. What I want to highlight in this definition is just the following. It's the same as the Council of Supply Chain Management Professionals is using for business logistics. The only difference here is that the term customer has been replaced by end beneficiary. This has its implications because there is a huge difference between being able to vote with your money and your feet or being a beneficiary in a process. But in any case, what is also to be highlighted is that logistics is logistics. It pretty much is independent of context. A lot of the same principles apply, a lot of the same concepts apply. We think the same way about warehousing, about transportation, about procurement, about all sorts of logistical functions, or concepts such as, say, vendor managed inventory. Whatever you find in the commercial sector, you'll find some sort of equivalent of that in the humanitarian sector, just as well. Of course, there are some specifics, and maybe the specifics are more coming from the context. Barczyk and Beeman at some point have gone through really well in terms of like what are the operating conditions for disaster relief and what are especially the operating conditions for humanitarian logistics. And there are lots of these issues coming up. What is unpredictable? Where do we need something? Who needs what? At which point is a disaster going to happen? And when do we need to activate our supply chain? What do we have on hand? What can we pitch? How do we deliver it? And so forth. But let me just read you the last quote because I think it describes this rather well. And it says, purchasing and logistics for major disaster relief is like having the client from hell. You never know beforehand what they want, when they want it, how much they want, and even where they want it sent. This pretty much sums it up what we are dealing with. You may say that there are other clients from hell as well, but in any case, that's what we work with in humanitarian logistics. Now, what's the other challenge? It says in the previous list that the lack of resources is a big challenge. So let me just show you the lack of resources currently. OCHA comes up and gets together all sorts of humanitarian organizations in something they call the consolidated appeals process every year, where they look at what they will need for the upcoming year, what kind of funding they need, and how to cover this funding and make sure that all sorts of humanitarian programs and activities are covered. Now, some of the forecasting is fairly accurate because we already know, of course, with conflict zones especially, that they are going to usually continue. Some of it is cyclical because we know of certain cycles of, say, annual cyclones, zones and cycles, hurricane seasons, things like that. But then comes other things like COVID-19, for example, was not exactly predicted for this year when in November this appeals process came out, but there are monthly updates. And to show you the monthly update right now, this is the latest figures. Currently, to respond to the big programs that there would need to be carried out, funding would be required in the almost approximately $40 billion. Now, you can see that the coverage of the funding so far is about 25%. So humanitarian activities do struggle quite a bit by a lack of funding, and with that, a lack of possibilities to deliver. To give you a bit of perspective in terms of trends as well, this is an oldie but goodie, and let me show you just the critical aspects of here. It's a slide that shows you the number of people affected by disasters every year, the number of people killed in disasters every year, and also how many disasters there are. This is not for natural disasters particularly, but and the figures are a bit different when it comes to, of course, conflicts and pandemics, but bear with me because you'll get to see quite a lot of the messages here anyway. So let's start with the good news. The number of people killed every year in disasters is going down, and it's going down rapidly. Typically, the reasons that we give is the following. One is we are getting better in forecasting. We are getting better in evacuating people. We are actually also getting better in mitigating some of the impacts. So that's why the number of people killed in natural disasters is going down. Then there is always a discussion of whether disasters or the numbers of disasters are going up or down. And you'll see it in the black color in this graph. And you'll also see that the number of natural disasters has been going up until especially in the early 2000s, and then it's gone down again. Now, it doesn't really tell you that much with numbers of disasters, to be fair, because it's the impact that will be a bit more important. So if you have many small ones, or if you have one or two big ones, you can still probably get to the same impact. But to the third message, this is the number of people affected. Now, the number of people affected in natural disasters alone is going up, and that has some implications for logistics, because the people we cater to when it comes to delivering aid is the people affected. So just to give you the summary of this, there is less death overall, there are more affected people. Now, this is a fairly average slide to give you the perspectives. Obviously, things do differ a little bit year to year, but it's the trend overall. Now, what does it mean for the logistical response? There are preparedness stock in all sorts of different regions. This is UNHRD's slide of where they have their preparedness stock. as to say, inventory for particular disasters that is pre-positioned. There we already think what can happen, and there we could possibly deliver from there. You will find similar figures and actually even maps when it comes to different humanitarian organizations. Not all of them have their stock in the UNHRD depot, even though that's a commonly used depot system. Then there is an association called the Humanitarian Logistics Association that works as some sort of community of practice. There are common standards and guides. This is the Logistics Operational Guide of the LOC cluster, which is coordinating logistical activities across organizations. And then you'll see some finer figure here. Now I'll put it up with this 80% of costs of humanitarian aid being logistics, because it is the main reason why we at the Humlag Institute focus on logistics and not all sorts of other issues related to humanitarian aid. There are many different other disciplines talking about disasters. There are many very relevant points when it comes to, say, anything from peacekeeping to negotiation, crisis management, to disaster management studies overall, and so forth. So there is a lot else in this area that is all relevant, including, say, gender studies in disasters. The reason we focus on logistics is just the sheer cost. Because if you can't deliver an item, you are still in trouble. I'll come back to that notion a little bit later as well. So this is just basically my first maybe introduction to humanitarian logistics. Do you want to have any questions, comments so far? Anything that you're particularly interested in that I should be maybe talking about more? Please write them in the chat now. Let's give us a couple of minutes for being able to do so.
In fact, we actually have a couple of questions already. Do you mind if I read them out?
Absolutely, because I don't see any in the chat.
Oh, okay. This is the questions tab. But here I have, what will the most important change in the teaching of supply chain management be to support the response of tomorrow's leaders to these black swan events like COVID?
Sorry, can you just repeat the beginning of the question? What would be the...
What will be the most important change in the teaching of supply chain management to support the response of tomorrow's leaders to these black swan events like COVID?
Okay, well, that's a very, very important question for sure. We've been looking at curricula quite a lot, in fact, and we've been looking at skills also that are required for logistics, including in humanitarian logistics, and at skills that are required for any kind of more dynamic environments. And it's interesting how some are probably more important than others for a dynamic business environment. And we've had a couple of publications with Peter Tatum on that particular topic. But in a nutshell, I think one of the problems that we face with logistics and supply chain management is that we've extremely emphasized lean management systems and just-in-time response and minimizing stock and things like that in our teaching. And this is not any kind of criticism against lean management. I think there are really valid points in it, and there are really valid points in also looking at when do you focus on costs and when do you minimize it, and how are you able to cut costs and address the actual problems and even see the actual problems, because one of the key aspects, of course, in lean management is to make problems transparent and visible. Now, what we have maybe a little bit overlooked is what do we do when it comes to all the other non-lean supply chains. And in fact, to be fair, there's quite a lot of these discussions already in supply chain management just in general, because not every supply chain is one of mass production where you can actually implement lean principles to begin with. And the more you customize, the more you itemize, the more you anyway have to be able to respond to all sorts of fluctuations and specifications of demand. You can do it by modularizing, standardizing. Of course, you know all of these supply chain concepts to begin with in that response. Where we have, though, a little bit focused more when it comes to, for example, the humanitarian teaching and curricula is definitely this whole idea of preparedness, for example. That, because it's also, even though now I put up that unpredictability of disasters is one of the key focal areas here, it's also almost naive to think that everything's unpredictable, because, and it's not a fatalistic view on things. We can predict certain things, there are forecasts, we as mentioned, there are cyclical events and patterns for disasters as well. So there are a number of things we can do to forecast those as well. The other issue is we can definitely look at more at resilience, agility, responsiveness, flexibility. There are lots of these concepts in supply chain management that already help in addressing these kinds of events. And then last but not least, maybe collaboration. We tend to focus on competition quite a bit in supply chain management, and making things competitive, and especially a cost focus is very much there, rather than sometimes looking at, okay, so what do we do if we have to work together? And now I'm not talking about working together with suppliers and customers, I'm talking also about working together with others, basically also with competitors. I hope that answers the question to some extent.
Great. There's one more question. Perhaps I can read that out as well, and you can continue. But it works really well with your current slide that you have here. They say, does a lack of funding for humanitarian activities promote any innovation in humanitarian supply chain management that spills over to regular supply chain management?
Well, to be fair, I think the biggest innovations in humanitarian supply chain management that spilled over so far are just basically this whole question of agility and responsiveness. I mean, show me any other supply chain that can, in 72 hours from getting an alert, not just put together, but deliver and set up a field hospital anywhere in the world. We've had projects with companies, and especially now with logistics companies, that wanted to do nothing else but to learn from the structural flexibility of humanitarian organizations and how to achieve that type of flexibility and agility. So these kinds of concepts do spill over quite well. Okay, just Victor, for you to know, I really don't see anything in the chat. It's completely blank for me.
Yeah.
So please do interrupt me with the questions.
Yeah, I will do. People are asking their questions via the questions tab. I'm not sure if you can see that one, but yeah, I will interrupt you as
I don't have a questions tab at all.
Okay. Well, I will. What I will do is I'll interrupt you as questions come in, if that's okay with you.
Very good.
Fantastic.
Okay, great. Shall I move on a little bit to COVID-19 then? Because I also from the questions I heard a little bit that could be of interest to people.
Absolutely.
Okay, let me go back to you. So let me show just some of the basics again first, but then I go into some of the issues that we also work with. When it comes to healthcare and humanitarian logistics, I think, let me start with just the commonalities. There is a lot that the two areas have in common. And now I take a step back, I'm talking of public health. Depending on where you are in the world, not every healthcare system is built around public health. And that might be a really huge difference in some areas of the world. But when it comes to the really public health and humanitarian aid, there are quite a number of things in common. First of all, the Hippocratic Oath. First, do no harm is a principle that humanitarians and healthcare providers both subscribe to. It's quite important to look at needs assessment first and to see what someone needs, whom who is an urgent priority? How do we deliver this assistance to people in need? In public health, we talk about triage. It's not necessarily something that is as a concept used in humanitarian aid, but it's the same idea that is being used when we talk about vulnerability capacity assessments, or VCAs. So you'll find it under that name further. There are some other things that I wanted to maybe highlight that are quite important. So needs assessment first is one issue. When it comes to, for example, humanitarian aid, one of the biggest issues that we deal with is the abundance of data and information the moment something happens. And especially nowadays, people want to talk a lot about social media, that, oops, there was, say, the port explosion in Beirut. So let's see who's been affected. Can we see it online? Who's been killed? Can we rescue people? Can we provide aid to them, etc.? One of the things in humanitarian aid that we need to focus on, though, is silence. The typical thing where someone is really affected is if you say have a hurricane swiping through a region and it impacts on a telecoms mast, there you might even have a geographical region with no message coming at all. And that's going to be the most affected region. So just like also in healthcare, very often you look at the people who don't shout, they might be the most urgent in need of help. The same applies for humanitarian aid and in humanitarian logistics as well. Another thing that I want to highlight is the question of equity, because when it comes to supply chain management, we tend to focus on effectiveness and efficiency, whereas here in performance objectives, we do talk about equity in health and also about aid equity, as to say, not just access to healthcare, but equitable access, the possibility of everybody to live up to their full potential in health. That's a really important aspect here. Then both areas do work with very highly sensitive data. We've had a discussion about GDPR with Victor just before this webinar, and the same thing applies there. You really have to see to it that nobody can access and see who's being affected. Beneficiary data, in particular in conflicts, can be super sensitive. We've had a project in conflict zones where we had to look and see to it that everything was having also in research several layers of security, because the data we dealt with could have impacted on people being actually a target. So it's an added sensibility and sensitivity that we need to think about here. The principles in humanitarian aid of humanity, neutrality, and independence, I guess they don't probably need to be introduced. It's just a matter of seeing to it that one doesn't prefer certain people over others, which obviously is just a really important issue for all of these areas. Then the last point that I want to highlight is that we are talking here of not-for-profit environments. And that's, of course, maybe the biggest difference to, say, a commercial environment. None of these organizations want to make profit. And this also goes for public health. It's not an idea to make profit. The point is to save people, to address people, to deliver aid, to assist people in need. That's a huge difference to other environments. And I cannot emphasize this enough, maybe. Then, looking at what is happening right now, there is a website called ReliefWeb that, where if you look at it, you will find which kind of disasters are currently being monitored, what are the alerts. The ones in orange are alerts, the ones in red, the bubbles, are already being responded to. And you'll find that in humanitarian logistics, there is a lot of response to epidemics as well. This is the update from today. So you'll still find, for example, response to dengue, to measles, to cholera, and unfortunately now again to Ebola, even though about a month ago we thought that the last or biggest Ebola outbreak had been eradicated. But the point being is that we can really learn here a lot from what has been done previously in the humanitarian sector, in particular in the humanitarian medical sector. Like, how do we deliver medical aid? What are the issues? What are the problems? How do we overcome these problems? We can learn a lot from that. So a bit more about pandemics in particular. There are a number of things we already know. And there are some health-specific issues and epidemic-specific things. What is it that we already know? We know that preparedness pays off. In fact, and I think some of you are from KLU listening in here, there is a really good study by Health Logistics and some researchers at KLU that looked at even the ratio of how much do you invest in preparedness and what does it then mean for the response. And it's a 1-to-7 ratio how it really pays off. So it definitely is worth it investing in preparedness stock, in training, in identifying when to mitigate what, and so forth. When I'm talking of preparedness, I'm not only talking about stock. That's what we tend to do in logistics. We tend to talk about pre-positioned inventory, but that's maybe not all of the picture. There are both curative and mitigative preparedness. As there is also research on the two different aspects of it. There are activities that you look at where to pre-position stock, of course, but also there are questions of like, okay, you see that there is a change in the climate, or you see that there are certain hydrometeorological events that you can already see coming in. So then do you activate the supply chain? When do you activate procurement? When do you activate and send in funds? When do you activate and send in people, and so forth? So there are a number of different things we can do. We also know, of course, and this is one of the answers I gave you also before, we've talked about agility, we've talked about flexibility and responsiveness for a long time. And it's really funny how we talk about those things, and there's heaps of research on these concepts. And yet, for example, it took us by surprise in a number of industries how COVID-19 would manifest itself. Other things I want to highlight. We know a lot of things about health-specific issues. Medical deliveries particularly are very interdependent. So in the global humanitarian system, there are things called interagency health kits. That's taking standardization and modularization principles in putting together standard packages that are defined for particular outbreaks, say. These standard packages can be, say, a malaria kit. It could be a cholera kit. It could be a field hospital. There are different ones for different types of outbreaks or different types of responses. The point is the following. If you have a vaccination program, you cannot really just deliver vaccines without gloves and syringes. And if it's a cold chain that you need to think about those kinds of aspects as well. So these interdependencies can't be overlooked. And if you actually look at COVID-19, in some countries, that was one of the biggest problems that they have been overlooked. That, say, there were testing kits, but not enough test swabs. Or in labs, in some cases in the world, we are struggling with not having enough reagents at this given point. So there are all those kinds of interdependencies that are quite important to consider. And we know of these interdependencies as such. The other issue in these interagency health kits is the following. The idea was that if, say, Médecins Sans Frontières would deliver a health kit somewhere, and it wouldn't be themselves who could use it, then any other humanitarian organization, let's say Médecins du Monde, could receive it, use it, know what is in which box even in the delivery, and just start setting it up and assembling it. So this is the whole idea about standardizing these kits, not just for the purpose of one operation or one organization, but also to make interoperability a little bit easier. Other issues we know is that, which are also health specific, is that health and medicine is heavily regulated industry. So we do know that there are specific drug lists that different countries have. We know which drug lists make the World Health Organization's list. We know how to deal with customs clearance of it, and that this is going to be an issue everywhere. We know, as I mentioned earlier, that a lot of medicine needs temperature control, as to say the cold chain, typically, and even that there are special material handling permits. Now, what do I mean by the latter? Not everybody is allowed to even enter a warehouse where there are certain drugs and certain types of drugs. So those kinds of clearances need to be there for the staff as well, not just for the materials in general. Then another issue that is quite important, and especially now in COVID-19, seemingly very much underestimated, is that there is nothing like a local healthcare supply chain. When we talk about medicine, we always talk about global supply chains. And now that many countries have started to have bans on one another or outbid one another for certain items, or making sure that they would have access to certain types of medicine, but not other countries, just really complicated the matter because they are suppliers and customers to one another. So if a country X doesn't let their drugs go to country Y, but is dependent on country Y's drugs, it doesn't quite make sense to have those kinds of export bans and stops. In fact, this is probably one of the biggest problems we deal with in COVID-19, that so many countries have come up with special sudden regulations. We've even had suddenly, and now remember when I showed you where in the world there had been so many places where we pre-position items, we even had situations where a country would not let pre-positioned, already export cleared items leave their country. They suddenly confiscated it all and didn't let humanitarian aid to be delivered. So that can be a really big problem.
We have a question from the audience, actually, that's somewhat related to this point. And that is, here it says, what are some standard protocols used in humanitarian supply logistics to filter out noise data? A lot of information may be coming in at once. How do organizations ensure they are acting on the right data coming in when actions need to be taken as soon as possible?
Whoa, good question. There are quite a number of things. I mean, there is a specific area of humanitarian IT that is focusing on triangulating data, that is looking at filtering out who said what, where do we have heat spots, for example, on a map, where do we not. Just like there's a log cluster, there is a telecoms emergency cluster as well, where they look at exactly these questions, like, you know, who is filtering what data. There's a lot about fake news and countering fake news nowadays ongoing. Many different organizations even had to now set up their specific units to make sure that they can filter out fake news that they would be otherwise reacting to, and at the same time to counteract fake news, especially related to COVID-19. It's an art in itself. But there are really people being specialized in these areas nowadays.
Right, right.
Is there any other question as well?
No more at this point, so it's just to continue.
Okay, good. Yeah, operating conditions still. I wanted to show you this picture because I took it in Zimbabwe, not now that I was there, but a decade ago when I was there a previous time, from a health clinic, because we are always talking about in the Western world or about issues with COVID-19, of whom do we deliver what to, how is our public health responding to this and that. But in the world, there are quite a number of different environments where public health care in itself might have very, very stringent conditions. This is a mission statement from a clinic in Rua. It says, to provide quality healthcare to all people in Rua using available minimal resources. And at the time when I visited this clinic, the clinic had one nurse, one stretcher, no bed sheets, some medicine, very basic things, a fridge, but then, for example, this is an environment where electricity is not a given. And even though there would be, for example, a cool box in this clinic where the nurse would take out the items from the fridge whenever the electricity was cut, if the electricity was cut at the time the nurse wasn't there, nobody would be able to do that. So just to put things a little bit in perspective, there are bigger problems in some areas in the world where even just the ratios of how many healthcare providers, how many medical doctors there are per people differ quite a bit. So the operating conditions of what we deliver also in this pandemic differ quite a bit as well. Something more about COVID-19. I mean, this is now a little bit from our current projects as well. We are looking at shortages and we're looking at how to overcome disruptions in medical supply chains in COVID-19. And we've been identifying quite a lot of different types of shortages, a bit varying in time and a bit varying, of course, across the world as well. Already in the very beginning, when we started the project, we knew that there wouldn't be enough PPE in the world. Now, how come we knew that? We knew that from the Ebola crisis in Sierra Leone, which is now almost a decade ago. At that point, there wasn't enough PPE and hazmats around in the world, and globally there was an outcry, and globally there was an effort made to increase that capacity. Now, that was for one particular Ebola outbreak. We knew that if a pandemic hits, a global one, there wouldn't be PPE enough in the world, even though quite a number of different countries have them pre-positioned PPE. Finland, where I live, has pre-positioned a lot of different medical equipment. But of course, not every country has. And even what has been pre-positioned here helped Finland in the very beginning of the COVID-19 response, but eventually you need to replenish, and these materials are consumables at the end of the day. Then other things we knew in the beginning were testing kits that we wouldn't have enough of, but then other things came up. So ventilators suddenly were out, reagents were out, IV fluids in many cases are not available enough. And right now we are discussing of oxygen being almost basically the currency in this pandemic. So there are different types of shortages that we are talking about. Then another big struggle is the struggle with face masks and the very different levels of quality that they can or cannot have. There have been so many scandals related to face masks and their production and different types of face masks not meeting quality criteria. In different environments in the world, it's pretty much countless at this point. When it comes to the product specifications, I would like to draw your attention to the fact that if you visit the World Health Organization's website and go to the COVID-19 response, they actually have a really good overview of what is needed in what technical specifications to what quality and so forth. So that's a fairly good standard overall to visit rather than reinventing the wheel. Yet other things we found in COVID-19. We talk about how many healthcare workers in the world have been impacted by COVID-19. Sadly, we have a similar issue when it comes to logisticians. And logisticians fairly broadly speaking. So now I'm talking about truck drivers, and in fact, also about truck drivers in many countries nowadays refusing to go to quarantine zones or bigger breakout areas. I'm also talking of even just people delivering your food in the last mile. There is ample, though still anecdotal evidence, how huge the outbreak is taking its toll on this industry and on people working in logistics. Now, I'm saying anecdotal is because there is very little statistics on it and very little, in a way, collected the same way as there would be about healthcare workers. It's a bit easier in hospitals to say, like, okay, how many of our own staff is being impacted? Then we also have a number of other issues. I talked about export bans earlier, but there is a lot of sub-optimization and a lot of panic buying. Bullwhipping, you know the concept. If you've never heard of bullwhipping before, I think COVID-19 is a prime example of how to even teach the bullwhip effect and make it very visible to the students, even if they just talk about toilet paper. Doesn't have to be medicine. And you have bullwhipping about very different items around the world. I think sometimes it's almost funny to see the cultural differences here. Whereas, for example, here in Finland, it was first toilet paper and actually painkillers. Then in some other areas of the world, like say I'm from Austria myself, yeast was one of the issues that was really very early on disappearing from supermarkets. And other things in supermarkets, what I found very interesting is in the US, for example, hair color was one of the aspects that started to disappear. But it really depends on where you are. Bullwhipping, when it comes to the medical items, is even more difficult though. There you have all sorts of dimensions of not just the PPE, but then considering with that on who is actually buying what. And there are different responses to it. So you would have areas where every single healthcare unit is buying their own equipment and buying their own supplies. You would have other areas where, to give you an example, in Finland, again, hospital districts buy their own equipment and stuff, versus elderly care homes have a completely different supply chain. Whereas, for example, the National Emergency Supply Agency here is trying to back them up and is trying to even identify suppliers that these others would not already reach out to. So to widen the supplier base. Then if I talk about Singapore as a very different example, there particular groups of items have been now identified that particular agents are buying as a centralized procurement for every organization that needs those items in Singapore. So there are different ways of reacting to it, but definitely we are dealing with a lot of these issues right now in the supply chain.
Great. There's another question that's come in regarding this, actually, and that is, do you believe that the disruption of supply chains resulting from COVID-19 will increase reliance on local, not global systems? How will this impact with less production capacity?
Well, as I mentioned earlier, there is no such thing as a local healthcare supply chain. So, I mean, in terms of reliance of local systems, there is not, you cannot produce everything locally. Even the very ingredients to drugs can be something that might not grow in your area. We are talking of a lot of different plant-based items. We are talking about not just things that you can produce in a lab if you don't have the, say, even the reagents to it. Now, things that you can do locally, you can definitely produce your own reagents. In most countries and most labs have started to a little bit go into that direction because that's something that you can often do. You can have a production changeover in many industries to produce face masks. Mind you, there are so many different layers and different types of fabrics that you need that not all of those fabrics might be something that you have in every country. So even that, as a from a supply chain perspective, is an issue. In other industries, it might be easier to go into local production and into production changeover, as we say in many different cases. But I have to tell you, not a lot of countries can even produce their own food just alone. So we are going to be very limited if that's what we think.
Wow. It's a bit of a scary thought as well when you think about it. And how interdependent we are. And actually another question just came in on the subject of interdependency here. Interdependency and dependency among actors in healthcare systems has been argued to deal with COVID-19. How controversial is this dependency when involving military capabilities to support response systems?
Involving military capabilities is always controversial, but there are different degrees to that. I mean, if you look at military capabilities of your own military, in your own country, in a peacetime situation, there I have to say most militaries in the world are first responders to all sorts of emergencies, not just these. Whether that comes to the delivery of items, or whether that comes to military hospitals opening up, or when it comes to some countries where navies, for example, have their military hospitals on navy vessels, and they can be very easily moved into different areas, or easier moved than many others. Those kinds of sea basing possibilities are really interesting to look into for sure. Where it becomes a lot more controversial is in a conflict zone, fairly obviously, or if you're talking of involving the military of a different nation. And that's also where, for example, I mean, humanitarians have very specific protocols to work with, or especially to not work with the military. It has to do with their neutrality and independence. When it comes to healthcare actors, it really depends again.
Fascinating. That's all the questions for now on this end.
All right, then let me give a couple of other things about COVID-19 still, because this is not still COVID-19, but beyond healthcare. We've been looking at a number of other supply chains as well, and we are starting more and more into looking at those. And you probably have looked at yourself at, of course, e-groceries and online shopping, and what does it mean for supply chain management. It's been quite a shift in many countries from going to your grocery store to trying to buy things online. It's been quite a huge revolution in this industry, including that it has made it happen that even demographics that were not typically buying things online have started to discover this possibility. Now, the problem with e-groceries is the following: it's super logistics heavy. You need a lot more staff to pick and pack items than you would need to just keep a grocery store and people coming themselves. There are big issues with transportation. There are big issues with delivery windows. Of course, if people really are at home, which they are in many countries, then attendance of the delivery times is still fairly okay. But then comes the next question: how do you deliver without overstepping the physical distancing regulations? And how do you make sure people get their items, the right items, and you're not exposing neither your staff nor the people you're delivering to any kind of contagion? So a lot of these kinds of issues have been suddenly coming up as big questions also in supply chain management and in the typical commercial supply chains as well. So observing health regulations is quite an issue here. We've seen now some innovation in this regard, and some of it is fascinating to look at. One is about looking at new delivery modes, anything from electric vehicles to using drones in deliveries, especially unattended deliveries because of that, and reducing the physical contagion. These can be quite interesting aspects. The other things that we've seen in some countries are new supply lines. So to give you an example from a kitchen, here in the Helsinki region, a lot of the restaurants have shut down when we went to a lockdown. But instead, what they did is to set up completely different production lines for the kitchens for food deliveries. And they set it up in a different way. So you would have kitchen lines separate from one another, quite a few separate from one another, working in parallel processing. You would have pickup zones where you would leave the food for delivery people to pick up, so that already there, between the parallel kitchen lines and also between the kitchen lines and the pickup zones, you would minimize potential contagion. And then the food delivery people would go and deliver food to their customers. Again, with very new ways, in the sense that suddenly now we don't enter people's homes anymore, but we just leave things at the door, ring the doorbell, go, and there is no attended delivery anymore. Everything else is electronic, the payments and so forth. As opposed to that, I know that in some other countries, the postal services have had really big issues already earlier, and for example, used to not deliver to your doorstep anymore. And some countries responded with the regulation coming in that no, they actually have to come to your doorstep, they have to deliver to you, in order to make sure that everybody is seen and people who are shielding still also can receive their items. But quite importantly, as a message maybe, in general, logistics is an essential industry in the pandemic, and it is quite important to look at it both in the healthcare side of it and also in the commercial side. Do you have any questions to this?
No questions at the moment. There's a more general question that's come in. Maybe I should ask that. It says here, how do we inspire more interest in the learning of humanitarian logistics, specifically within the business school setting?
Well, I guess generally to inspire more interest is to come to these kinds of examples. I mean, things that impact on people's lives is always something that they are more interested in also learning more about. There are some other things that we use as reasons for why this is of interest, apart from the fact that this is the most agile supply chain that we know of, and that is that it's a growing industry. And even though it's not a profit-making industry in the sense that that's also not the aim, when it comes to it, it's a huge industry to supply to. So quite a number of business supply chains are also supplying to the humanitarian sector. And as such, that should not be neglected, and especially because it's also a counter-cyclical industry. So whenever everything else is struggling, this is an industry that typically needs more and has a lot more demand to fulfill. So in a business school, those have been very important aspects to highlight for people to look into it. Even just as if you end up working for a supplier of this industry, you need to know how it works.
Great. I think we only have another minute or so to go. So do you have any kind of summary or wrap-up comments at the moment?
I think I'm going to jump off a couple of things and give you two issues here. One is the humanitarian supply chains. And sorry for jumping over some of the sustainability aspects overall, but I'm sure you can go through it yourself as well. We've been talking, of course, about similar sustainability issues, anything from greening operations to climate change mitigation and adaptation and so forth. Maybe one thing that I want to highlight is that at the very end of the day, even though we are trying to change how we deliver, and for example, we have systemic change delivering cash instead of items, at the very end of the day, the basic mandate is that we still have to deliver. And one way or another, people need to be able to meet their needs. So the basic logistics mandate will be there. Another thing I wanted to show you as a very last thing is just this. If you want to have more information about what we do at the Humlog Institute, please visit our website. And if you want to have a very easy introduction to humanitarian logistics that you say integrate in your own teaching, we have a MOOC that we have developed, and that is free to use for other universities as well. So by all means, we do encourage you to send your students to that.
Fantastic, Professor Kovacs. Thank you so much for a really great presentation. And I've thoroughly enjoyed it. I hope everyone in the audience have too. We'll be providing a recorded version of this webinar to everyone in the audience and everyone who registered who could not make it. So that will be provided, and it will be on our websites as well, so people can watch it. Once again, Professor, thank you so much for this presentation. And for everyone in the audience, keep your eyes open. We'll be having more people coming on board from our business schools, our accredited business schools, presenting on various topics, especially relating to the COVID situation. So thank you very much, everyone, and have a lovely afternoon or evening or morning, wherever you are. Take care.
Thanks from my side as well. Take care. Hope to talk to you soon.